Unmasking Ulcerative Colitis, From Causes to Treatment, your comprehensive guide. Are you curious about ulcerative colitis? Whether you're looking for answers for yourself or seeking to understand a loved one's condition, this comprehensive guide will provide you with the information you need to know. Join us as we unravel the mysteries of ulcerative colitis and discover ways to cope with its challenges, all while moving towards a brighter future. Hey there, welcome back to MindState. We're here to help you tap into your full potential and become the best version of yourself. In this video, we'll dive into the world of this complex disease and explore its causes, symptoms, diagnosis, and treatment options. But before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. Unmasking ulcerative colitis. What causes it? The triggers of ulcerative colitis, though not yet fully understood, are believed to be influenced by various factors that intertwine in a complex web. In this exploration, we'll delve into the fascinating realm of this condition and shed light on some key aspects that could potentially contribute to its onset. One prevailing hypothesis that has garnered attention is the abnormal immune response theory. According to this notion, ulcerative colitis arises when the immune system mistakenly identifies the lining of the colon as a threat and launches an inflammatory attack against it. This immune dysfunction triggers chronic inflammation, resulting in the characteristic symptoms experienced by individuals with the condition. While the precise trigger behind this immune system malfunction remains elusive, researchers continue to unravel the intricate mechanisms involved. Genetics is another captivating angle to consider in the quest to unravel the mysteries of ulcerative colitis. Studies have shown that there is a genetic component to the development of this condition. Certain genetic variations or mutations can predispose individuals to an increased risk of developing ulcerative colitis. Researchers are actively investigating specific genes and genetic markers that may contribute to the susceptibility of developing this inflammatory bowel disease. Understanding the genetic landscape is crucial for comprehending the underlying mechanisms and potentially developing targeted therapies. In addition to immune responses and genetics, certain risk factors have been identified as potential contributors to the development of ulcerative colitis. Age, for instance, plays a role, as the condition often manifests in young adulthood, although it can occur at any age. Ethnicity is also a factor to consider, with some populations exhibiting higher rates of ulcerative colitis than others. Moreover, individuals with a family history of the condition have an increased likelihood of developing it themselves, suggesting a genetic predisposition that can be passed down through generations. Navigating the symptoms. How does ulcerative colitis manifest? As we dive deeper into the realm of ulcerative colitis, it's essential to understand the wide spectrum of signs and symptoms that can manifest in individuals affected by this disease. From mild to severe cases, the presentation of ulcerative colitis can vary, but certain common indicators serve as red flags, guiding us towards a potential diagnosis. One of the hallmark symptoms of ulcerative colitis is persistent diarrhea. The bowel movements become frequent and loose, often accompanied by an urgent need to use the restroom. This persistent and sometimes uncontrollable urge to pass stool can significantly impact a person's daily life, causing disruptions and discomfort. Abdominal pain is another prevalent symptom experienced by individuals with ulcerative colitis. The pain may range from mild cramping to intense discomfort, typically localized in the lower abdomen. This abdominal discomfort can be persistent or intermittent, affecting individuals to varying degrees. Rectal bleeding is a significant concern for those with ulcerative colitis. The inflammation in the colon can lead to the formation of open sores or ulcers, which may cause blood to appear in the stool. This rectal bleeding can range from mild to severe, with some individuals experiencing significant blood loss, leading to anemia and other complications. Fatigue is a common companion of ulcerative colitis. The chronic inflammation and persistent symptoms can take a toll on one's energy levels, leading to feelings of exhaustion and weakness. Fatigue can have a profound impact on a person's quality of life, affecting their ability to engage in daily activities and work. Beyond these primary symptoms, ulcerative colitis can also manifest in additional ways. Weight loss may occur due to reduced appetite, malabsorption, or increased metabolism as the body fights inflammation. Nutritional deficiencies can arise from impaired nutrient absorption in the inflamed colon. Fever, particularly during flare-ups, may indicate an exacerbation of the disease. It's important to note that the impact of ulcerative colitis goes beyond the immediate symptoms. Over time, this chronic inflammatory condition can lead to potential complications. These complications may include the formation of strictures, narrowing of the colon, perforation, formation of holes in the colon wall, toxic megacolon, severe inflammation causing the colon to enlarge, and an increased risk of colorectal cancer. Understanding and addressing these potential complications is crucial for managing the disease effectively. The diagnostic journey. How is ulcerative colitis diagnosed? The initial step in the diagnostic journey involves a thorough evaluation of the patient's medical history and symptoms. A medical professional will take the time to listen to the patient's concerns, inquire about their symptoms, and gather information about their medical background. This comprehensive assessment helps build a foundation for the subsequent diagnostic tests. Blood tests are often employed to gather valuable information about a patient's overall health and assess potential indicators of inflammation. Elevated levels of certain markers, such as C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, can provide clues regarding the presence and severity of inflammation in the body. To gain a closer look at the colon and rectum, endoscopic procedures are commonly employed. One such procedure is a flexible sigmoidoscopy, which involves inserting a flexible tube with a camera, sigmoidoscope, into the rectum and lower part of the colon. This allows the doctor to visually examine the lining of the colon and identify any signs of inflammation or ulcers. In some cases, a colonoscopy may be performed, which involves a similar procedure but examines the entire length of the colon. Biopsy samples may be obtained during endoscopic procedures to further confirm the diagnosis. Small tissue samples are collected from the colon lining and analyzed under a microscope. These samples provide crucial insights into the presence and severity of inflammation, as well as help rule out other potential conditions with similar symptoms. Imaging techniques can also aid in the diagnostic process. X-rays, computed tomography, CT scans, and magnetic resonance imaging, MRI scans may be utilized to visualize the colon and surrounding structures, providing a comprehensive view of the extent and severity of the disease. These imaging modalities assist in assessing potential complications, such as strictures or perforations, and help guide treatment decisions. In some cases, a barium enema or a virtual colonoscopy may be recommended as alternative imaging procedures. A barium enema involves the introduction of a contrast material into the colon, followed by X-rays to visualize the colon's structure. Virtual colonoscopy, also known as computed tomography colonography, utilizes CT scans to create a detailed virtual image of the colon. Unveiling treatment options. How do we tackle ulcerative colitis? One of the primary treatment avenues for ulcerative colitis involves the use of anti-inflammatory drugs. These medications, such as aminosalicylates, work to reduce inflammation in the colon, thereby alleviating symptoms. Aminosalicylates are available in various forms, including oral tablets, suppositories, and enemas, allowing for targeted delivery to affected areas of the colon. In cases where anti-inflammatory drugs alone may not suffice, immune system suppressants come into play. These medications work by modulating the immune response and reducing inflammation. Corticosteroids, for example, can provide rapid relief during flare-ups, but their long-term use is generally limited due to potential side effects. Other immune system suppressants, such as azathioprine and 6-mercaptopurine, are often prescribed to maintain remission and prevent future flare-ups. Biologic therapies have emerged as a significant breakthrough in the treatment of ulcerative colitis. These medications target specific molecules in the immune system that are responsible for inflammation. Biologics, such as tumor necrosis factor, TNF inhibitors, and integrin receptor antagonists, have shown remarkable efficacy in inducing and sustaining remission, especially in individuals who have not responded well to other treatments. They are usually administered via injections or infusions under medical supervision. In addition to medications, certain lifestyle modifications can complement the treatment plan for ulcerative colitis. These may include dietary changes, stress management techniques, regular exercise, and adequate rest. While they may not directly cure the condition, these lifestyle adjustments can contribute to overall well-being and help individuals better manage their symptoms. In severe cases of ulcerative colitis, Where medical therapy proves ineffective or complications arise, surgery may be considered. Surgical interventions aim to remove the diseased portion of the colon, thereby eliminating the source of inflammation. Procedures such as colectomy, ileostomy, or ileoanal pouch surgery may be recommended based on the specific circumstances and individual needs. Surgery can provide long-term relief and significantly improve the quality of life for individuals with severe ulcerative colitis. Living with ulcerative colitis can present physical and emotional challenges, but with the right knowledge and support, it can be managed effectively. In conclusion, we'll discuss coping methods to help you navigate this condition's impact on your daily life. From dietary considerations to mental health management, we'll provide practical tips to improve your overall well-being. Remember, with expert medical care and a proactive approach, you can regain control and live a fulfilling life. Thanks for watching, MindState fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.